Aloha and good morning. Thanks so much for joining us here for Spotlight Hawaii. I'm Ryan Kalei-Suji, joined of course by Yanji Denise. And today we are going to be island hopping and traveling over to the island of Maui.
That's right. We are joined by Maui Mayor Mike Victorino, who is joining us live from his office there. Thank you so much for being here, Mr. Mayor. We really do appreciate the time.
Oh, unfortunately, Mayor, your mic is muted. So
Not anymore. I got
there you go.
The world of technology still hasn't caught up with me. I apologize. Good morning and aloha to everyone. And I want to say a particular mahalo to you and the Star-Advertiser for this program. I think it's been a very interesting dynamics where leadership has been able to say and tell you how we feel and why we do what we do. And I want to say mahalo to all of that.
Well, thank you so much. We do appreciate it, and we have so much to talk about with you this morning. Let's start first of all with vaccinations in the county. How is the vaccine program working for you folks, and is there enough demand to meet the vaccines that you have right now?
Well, let's first of all say that it has slowed down. I think the whole state nationwide is beginning to slow down. There's a comfort level, and I think because the CDC has made changes in some of the mandates, people are now becoming a little more at ease. But there's a big challenge out there called resistance due to lack of FDA approval. FDA approval has been done under the emergency proclamation, but they still have tests they have to complete to get finalized and have a FDA approval of these various vaccinations. And I think this is where a lot of people I've been hearing from the public who've been saying, I don't want to until it is truly authorized and approved by the FDA, not under emergency service, but under the regular protocols that are in place. I can respect that, and I understand how people feel, but I'm also telling them that if you don't get vaccinated, and I can give you a major example, like what happened on Molokai, this last cluster, without vaccination, those who weren't vaccinated were more susceptible. Those who were didn't get any contaminant from the spread. So it does prove that the vaccine is working and is effective. For Maui right now, we're at 52%. I've seen a real slowdown because 4 weeks ago, the hospital was doing 800 a day. Some of the pods were doing 400 a day. I met with the hospital staff yesterday, and they've dropped down to like 300 to 500 a day, and open to walk-in. So we've seen a slowdown. We've seen a small spike because of the now 12 to 15-year-olds are being added. So we've seen parents taking advantage of that. So it's been a kind of helter-skelter in the sense of numbers, getting enough doses prepared and not wasting them. That's been the real challenge. When they're defrosted, they've got to be used within a certain period of time, or they become non-effective and have to be thrown away. And we're really wanting not to do that. We want to make sure, put the doses in the arms and get people vaccinated.
We, of course, know that Maui County is a county that's far spread across multiple islands and has a lot of rural communities. What sort of efforts are being made to ensure that those rural communities have access to the vaccine and the availability to get them should they decide that they want to?
Well, many of the rural communities, we have mobile units that have been going out there, not only for testing purposes, but for vaccination purposes, going out to Hana and those areas, those remote areas right here in Maui itself, on Maui Island. We have the Queens as well as Straub and our Maui Health system who have been doing Lanai. Molokai is Queens. And I want to say with the Department of Health help, we have gotten pretty much, I think in Lanai, the last number I saw was 67% have been fully immunized on the island of Lanai, and like 53% on Molokai. And so we have good numbers, but not everybody, is taking it now. And the fear, that hesitance is really slowing down everything, slowing down the process. But we keep promoting it, we keep asking, and I think people are now seeing the residual effect, and more of them will go in and get vaccinated.
Are you confident that the Molokai cluster has been contained?
I believe so. And we have our health experts there. Our Department of Health and Queens have worked very well hand in hand to make sure the spread is minimized. But it's really up to the people. I mean, you can't do anything if they don't want to listen and continuously go out and just meander about and then not worry about spreading it. So for right now, we do believe we have it under control. The numbers are starting to level off, and so we're hoping that everything will work out like we did in Lanai. We got in there, we sanitized, we did testing. We're doing whatever is necessary to protect the people of Molokai, like we did on Lanai and here in Maui Island itself.
You know, on Monday, we had Governor Ige here on the show, and we talked more about his decision not to follow the CDC recommendation when it comes to mask wearing. He's saying that he wants to continue to make sure that that mask mandate that is in effect for the state of Hawaii continues to remain in place for the time being. Do you agree with the governor in his approach to the mask mandate that the state has, initiated and not necessarily following the CDC guidelines, saying that mask for those who have been vaccinated is not needed?
I agree with the governor because, first of all, how do you determine who's vaccinated and who's not? I mean, we're doing inter-county travel right now, and with your card, they let you travel without taking a test to come to Maui or Kauai or Hawaii Island, right? So we have exemptions already. As far as the masks are concerned, I still feel like the governor, we still need to utilize it, especially indoors. Outdoors, I'm more or less saying, if you get a big gathering, you can physically distance, like sporting events, spectators. I really think if you're close contact, you should wear a mask. But if you're 20 feet, 100 feet away from each other, and you don't wear a mask and you're within your family cluster, your household cluster, I don't have a problem. It's just really at this point, I would like to side on the area of caution. Be cautious right now. I see we're at the home stretch as far as vaccinations and getting people protected. I see the light at the end of the tunnel, and I want to make sure we get there by July, if at all possible, so that we can continue to reopen not only Maui County but the entire state.
Maui County definitely in the reopening has seen an influx of tourists. We know that your island is particularly popular right now, especially with people from the West Coast. We see these stories about the rental cars running out and just a high influx of people. So many folks here in Hawaii have gotten used to no tourists for some time, and then to have all these people coming back has brought some tension. Can you talk a little bit about that?
We're having the same challenge here as the rest of the state, but more so because Maui is a very popular destination, and we want to protect our resources. That's why back in 2019, I changed the policy that Sundays and holidays were reserved no commercial activities at our beach parks, so that our residents would have a day not traversing over surfboards and windsurfing boards and scuba gear and all of that. And that is still in effect, and it's still working very well. However, our beaches have been really inundated with not only visitors, but our residents who got used to having the beach to themselves. So we're trying to manage that in a sense of, let's work together. Let's show aloha. Most of the visitors are very respectful. The few knuckleheads out there, unfortunately, drive us crazy. And like you and every other county, we've got to deal with them. However, the vast majority are good visitors. They come here healthy. They want to stay healthy. They want to go home healthy. That's why the post-test has been very successful overall. We've done almost 37,000 tests in 2 weeks and found just 18 antigen. And when we did the PCR confirmation on those antigen cases, only one was positive. So we know the visitor coming wants to be healthy because they're coming in healthy. They're doing their post-test before they arrive, right? And then they're doing this secondary test when they arrive. The vaccination exemption for those people have worked very well. About 31% of all the visitors have their fully vaccinated cards coming in from California, wherever. So it's working. So actually, this is a good prelude to what we will hope to do in July, is have a trans-Pacific vaccination exemption like we've been talking about. And hopefully Maui will show the residual effect, will show the results, and be very positive as far as the rest of the state is concerned.
How long do you think that you folks will be continuing on with this post-arrival testing? You mentioned those numbers and what you guys are learning through this process, but do you foresee that happening and continuing on for some time?
Well, I'm really committed to at least 45 to 60 days. In other words, a month and a half to 2 months. And from there, we're going to see what the overall results are. If they continue with this, probably we can discontinue the secondary tests. And because, again, more people will be vaccinated, more people will be coming already fully vaccinated. And our population, hopefully by that point, would have reached at least 60 to 65% of the fully vaccinated group and have at least 70, 75% of those who have at least gotten their first dose. So that is our hope by middle of July, and that's where I'm looking at. And so we'll see how it all works out. We continue to wanted to protect the well-being of our residents, and that's why this test was to prove that our residents are the ones that, in the past big numbers, like our Maui Community Center and others, correctional center, they caused big spikes, and it was because it was community driven or community spread.
You know, you mentioned limiting activities on Sunday. Do you think that there should be more steps like that, perhaps adding another day, Saturday or a weekday, that there would be limits on commercial activity? We know that Maui led the way in some instance when they implemented that reservation system on Haleakala. Could there be other places where you would do that, where you would limit the number of people who could access certain places that are that local people feel are over touristed at this point?
Absolutely, and we are working towards many of our parks. We're doing Wainapa Napa out in Hana. We have a reservation system for the East End, and we're taking that same system and turning it to South and West Maui, where many of the popular destinations are. And something like what you do at Hanama Bay, we will charge our visitors to come in and limit the number of people that do come in each and every day. Have a day off for cleanup and uh, uh, what I call what I would use the word is reestablishing the day and the property. Yeah, maintaining the property and maintaining the resources is very important. So we are working on plans right now for other beaches and other areas throughout Maui County to be preserved, and having days where they may be able to close entirely for cleanup and restoration, and making sure it's not being taxed beyond its means. So we are working on that at this point. So you're absolutely correct. I am, and I'm really a believer that we've got to protect our resources, and some of it is education of our visitors. Some of it is our residents helping with that, and the respect and the kuleana that's put into this will end up making sure that our island is protected as best we can.
One of the things that we also are seeing, of course, every month, the number of tourists and arrivals to Hawaii continues to go up as more people feel comfortable traveling, as more people become get the vaccine and are traveling with those who are fully vaccinated. But I'm wondering if Maui County and the infrastructure is ready to handle a larger influx of people. We're seeing some of these long lines that are at the airport. Of course, a large part of that is due to the post-arrival testing, the verification of the vaccine, or the testing that people have to take prior to coming. Do you feel that the infrastructure at the airport, as well as other places around the island, is back up to speed to handle the influx of guests and returning residents and visitors that may be coming to your island?
Excellent question. And as you can see, there are many areas that we've had to make changes. And I know our airport, I'm in close contact with the airport manager. They're doing changes as far as transpac flights being putting more in one area and inter-island in another, so we can distinguish between the two. Also trying to reduce lines by making the checkpoints more efficient, putting more people. And again, as we learn through these various exemption program how to better manage it, we will get better at what we're doing. And once we stop the post-secondary test, people who are fully vaccinated, maybe in the not too distant future, like they're doing for Hawaii residents, if you're fully vaccinated 14 days out, we just show you the card, put the QR code, you're off and running, you're on your vacation, or you're out to see your family. I think that has been very well accepted, and we're learning a lot of the challenges and corrections that need to be made. So when we move to the next level, which is transpac, we will be much more prepared. When you're talking our infrastructure on the county end, our roadways, our sewer, our water, we saw much higher numbers prior to the pandemic. and we were already seeing that what it's taxed, how bad it was getting taxed. So now we're trying to manage better as far as our numbers are concerned. We're going to implement some other restrictions, maybe some other fees that will slow down the people coming in. So managing tourism has a multifaceted approach, and we're kind of putting the roadmap together along with HTA and others. We're going to make sure that our visitors come in, have a wonderful time, but are not taxing our resources, and that the residents are always protected in their well-being.
What kind of fees would you be looking at? Would these be toll roads, for instance, or more user fees for beaches? And would Hawaii residents or Maui County residents be exempt for those fees, or would they apply to everyone? What specific areas are you looking to add taxes to, if you will?
Thank you for that question. I'm looking at our beach parks, parking, putting so many parking stalls for our residents, which will be free. As long as you're a resident, you're not going to have to pay. Having paid parking for those who want our visitors, that would be one of them. I don't think we can do toll roads because it is a HRS restriction. If the state changed it, maybe we could look at it. But most of our main highways are state controlled, and unless the state took it on, we can't do it. Also, fees for our residents would be always exempt from utilizing our beaches, where visitors who are here for just a short time, they don't pay real property tax. They don't pay a lot of other fees that our residents pay. They would share a little cost in maintaining and protecting our environment and our resources. So it is really, burden is going to be on the visitor and not on our residents.
I wanted to get your thoughts on the recent legislature that was passed regarding the changes to the TAT and the county's ability to alter the percentage points and just the overall structure of the TAT as well as it stands now, and the changes that have been introduced this past legislative session. How do you think that will impact your county, and what are your overall thoughts about the way in which the legislature restructured the entire TAT tax?
Well, first of all, I didn't like the idea, and I don't support what has happened. However, I am in favor of the county being able to institute their own tax base for transient accommodations. I think this is important because we are the ones who respond to emergencies. We also respond to cleanups and parks and everything the visitor enjoys. Many times the county is the responsible agency or entity that takes care. So this money will be well spent in protecting the environment and protecting the resources of the county. Also, that money would help us maintain the number of tourists, because when you get to a certain point, maybe certain people won't come. Maybe they'll say, no, enough, I don't want to go to Maui. And for us right now, maybe that wouldn't be a real bad issue. We could use a little less tourism and more of what I call our new economy, which is wellness and technology, things like that, that will push us into other areas where if tourists and tourism falls every so many years, you have a downturn for some reason or another, this state won't be inundated like what happened with 9/11, what happened in 2007, 8, and 9, and what happened with this pandemic. We will be more diversified. And that's what the drive for Maui County is. We welcome our visitors, we love them, but we're trying to make sure we manage that also with other economies that can help augment and make sure that they stand alone and are safe and thriving no matter what happens.
You know, one thing that certainly costs the county a lot of money when it comes to visitors is when visitors need rescue. If they get lost on a hike, or they go to a beach that they're not supposed to be going to, and then they need resources. Do you think that visitors should help to shoulder some of the costs when it comes to having to be rescued?
I've been torn with that. It's another great question. I'm torn with that idea that I don't want somebody to hesitate to call for help because they think they got to pay for it, that they must pay for that rescue. But on the other hand, it's an enormous cost that we bear each and every year, whether it's our helicopter, our air ambulance, our fire and rescue, ocean safety people. They're out there doing this every day, and really becomes a real challenge. So I'm torn with the idea, but I would be in favor of some kind of fee paid into this whenever you need to get rescued so that we don't bear the total cost. How we would do that still needs to be worked out. My executive team, along with some of our legislators, are talking about it to see what we can do and what would be legal. Also, we don't want to say if you don't pay, you don't get rescued either. So this is one of those real challenging moves, but we're working on it at this time.
Of course, COVID-19 has impacted the healthcare systems and inundated hospitals that we've seen, throughout the world. But the other significant impact has been its hit on the economies and local economies. Of course, Maui County, a small county and community that thrives off of local businesses and supporting many of these independent small business owners. I'm wondering what you're hearing from your constituents, from those in your community. How has this pandemic impacted the overall local economy on Maui, and what efforts are you doing through your administration to help those small businesses that continue to be struggling during this time?
Another great question. And you asked like 5 questions in one. So let me break it down. I love when you guys go in and give me 5 questions in one question. But let me start with overall Maui County. Many of our small businesses closed. Many did not reopen, and that's happened in Oahu. It happens all across the nation. And as sad as it may be, some of them will never reopen. But there's others that have consolidated, merged, changed their basic operation, and now are beginning to rise and thrive here in Maui County. And I'm pretty proud of that. We've had programs through our Chamber of Commerce, through the Credit Union, CARES Act money that went directly to businesses for changes that needed to be made for safety, for the well-being of their employees and customers. We gave direct support for those who lost revenue during this period of time, and there's more money coming from the American Rescues funding. So as that money comes in, we want to make it go directly to those who are being impacted, our small businesses. But we also had Kamaina First program. We had the Pop-Up Makeke, the Made in Maui. We've done a lot of programs to make sure our vendors, our entrepreneur and local sector wasn't left out, along with our visitor industry and other ancillary services that tie into our visitor and hospitality industry. So we're all tied together. One business fails, it hurts everybody. So we need to continue to work together. And our administration has been very committed to helping not only small businesses, but businesses around. When this pandemic started, farmers were looking at plowing under their fields. I immediately bought produce from our farmers, from all various farming groups, and distributed to the people who had lost their jobs. So we had food distributions back in April of last year. We were ahead of the curve because we didn't want to wait till the feds did something. We had to do it here. Our ranchers also benefit from direct purchases of meat to be put in these boxes for those needy. So we've worked and worked and worked all segments, whether it's agriculture, technology, hospitality, small businesses, because they're all interrelated. One connects to the other. We're not siloed. We are actually one community. The county of Maui needs to continue to work together.
I want to go back to, you said something that was interesting, which is that you're comfortable with perhaps not having as many visitors, perhaps trying to pivot the economy in certain ways. And also, this goal that the HTA and the state has had for some time to try to target a higher spend tourist. To that end, we've heard a lot about the rental car limits, just that there aren't enough rental cars right now on Maui and really throughout the country. This is a problem in a lot of tourist destinations. Do you think that we should get back the level of cars, or should there be limits on how many rental cars there are on your island? Because a lot of people said they sort of enjoyed not having so many cars on the road.
I remember the sea of auto, or I call Lake Auto, that surrounded our airport. All those vehicles that sat there, thousands, I think it was tens of thousands of vehicles sat there. And finally, they were able to dispose of them by either sending them back or selling them off. And now the visitor comes back and there's not a lot of vehicles available. Well, this is something we've got to really continue to look at, more mass transit or group transit instead of more cars on the road, because I'd like to see some kind of limit put in the not too distant future on the number of rental cars that are available here in Maui County. I think Oahu and every other county would agree. When you get all of these visitors driving at 4 o'clock or 7 o'clock in the morning or 4 o'clock in the afternoon, how much more that adds to the congestion of our residents. And I know many residents, including myself, used to love to go to Lahaina and it would take you 25 minutes. Now it's back up to 40, 45 minutes. We see the change. We welcome them back, but do they need a vehicle to go everywhere? Many times, maybe not. And so how we can change that is all part of our plan to make more what I call destination transportation available, where shuttles can take you from your hotel maybe to downtown Lahaina instead of taking your car and parking it on the street. You know, we know there's limitations in everything, and we need to continue to work on plans to make sure that limit is met and not exceeded. And that's where we're working hard here in Maui County. And I believe all the counties are looking at it pretty much the same way. We welcome the visitors, but we've got to be more mindful and respectful of the Aina, the Kai, and the Vai, or we're going to lose it quickly and not get it back.
You know, I want to ask you a question here as our time is beginning to wrap up. But, you know, this has been a time where you, as the leader of Maui County, have had to work with the other mayors of the other counties, with the governor and his administration extremely closely. At times in the beginning of the pandemic, there were conflicts of communication and breakdowns in what each county were doing, and sometimes some disagreement. I wanted to just get your overall thoughts on the way in which the dynamics have played out with you and the other mayors and with the governor, and your overall working relationship during this time.
Well, thank you for that question. You know, I was blessed to have a great executive team here in Maui County, and all the entities like nonprofits, businesses, others came to the table and helped us during this time. So it was a collaborative effort. When it comes to the governor and the other mayors, and now I've been fortunate that I've worked with two mayors that have left office, Harry Kim and Kirk Caldwell, and they were wonderful to work with. And now we're working with Mitch Roth on the Big Island and Rick Balangiardi in Oahu. Again, great gentlemen to work with. Derek and I have seen the changes. We've worked through this over the last 2.5 years, you know, and it's been not easy, but I think with our knowledge and our experience, we've collaborated, worked together. We've had disagreements, yes, I won't deny that. And sometimes there are very heated disagreements. But like any family, you get your good and bad. You get the days you argue with your kids, and the next day you love them, and everything's cool. You know, and so we're one big family. The Ohana of Hawaii is one big. We have learned to live resilient. We have learned to be sustainable from when I was a kid, which was many years ago, to today, and hopefully forever, because we're an island county, an island state, and we need to continue to depend on each other. And for all I'll say this, it's been a great working relationship, not always perfect, but a relationship that I've been honored to say we have worked well together in all of these adversities. And I'm thankful to not only the governor and the other mayors, but their administrations, their staff, their directors. It's a multi-leveled approach that we've taken, that working together has really brought us to this point, and hopefully will make us get to another point where we can be more resilient, more diversified in our economy, and still have hospitality as a driving force.
The time goes so quickly. We are almost out of time. I want to give you an opportunity to talk to folks. You know, we started out this conversation talking about vaccines and some vaccination apathy, if you will. Do you have a closing message for the folks watching today, specifically those who might be on the fence about getting the shot?
Thank you for that question. It's difficult, but I will ask again. Please get vaccinated. It is a method of protection that we all can enjoy. Right now, if you're not vaccinated, wearing a mask is very important right here. You see this? Very important for this county and all its people. That's your family and friends I'm talking about. Finally, I will say this. We are one community. We are one state. We are one people under God. And we need to work together to protect and enhance the life that we so richly deserve. And we need, at this point in time, everyone getting on board and saying, we need to hold hands, work together to make Hawaii, United States, and the world a better place for future generations. For me, I see 3 generations out. I have a great-grandson and a great-granddaughter, and I see them, and I want to make sure their future, 50, 60, 70 years from now, is protected, and that we have all these changes with climate and atmosphere and gas issues and everything else resolved and protecting their future so they can enjoy the lifestyle I grew up with, and all of us would like to make sure we pass on to them. So mahalo for your time. I really appreciate it. To the people of Maui County, I say mahalo for everything you've done. Please continue to work hard. We are getting there. And to you, at the Star-Advertiser, mahalo for everything you do. I've enjoyed this program. I hope I brought some light to some people. If not, I apologize.
No, it was a great conversation and great to catch up and really get an update from what's happening over there on Maui and Maui County. So thank you so much, Maui Mayor Mike Victorino, for joining us this morning.
And I'll close with this. You're always welcome to come, both of you and your family. How's that sound?
Thank you. Sounds good.
All right. God bless you all. Aloha. Mahalo.
Aloha.
Aloha.
Great to hear from Maui Mayor Mike Victorino there. Interesting to note that he agrees with the governor at this time on continuing the mask mandates, despite what the CDC has said. He just expressing his confidence in the mayor's choice and the governor's choice there. Also that he's going to keep the post-arrival testing for some time to try to weed out anyone coming into his county that may be positive with the coronavirus. And also interesting to hear about the limits on tourism that he and his executive team are taking a look at right now.
Yeah, a lot of different options out there. Really a time for the county and the administration that he works under to reassess how things are operating. You know, he mentioned those sea of cars that we saw images of during the pandemic that were parked right outside of that Maui airport. And it really helped to illustrate just how many roads were on the cars were on the road, not only in Maui County, but we also saw that image here on Oahu at Aloha Stadium. And so the mayor talking about possible solutions to helping to reduce the carbon footprint, if you will, and the amount of cars that are on the roadways there on Maui. And also him advocating for people to continue to get the vaccination shots. He also mentioned that they are seeing a decrease in just the overall shots and arms that they're performing per day, but that they will continue to push hard to make sure that those who want to get them have access to get those shots.
Yeah, and very interesting conversation, and it'll be interesting to see if other counties adopt this as well. The idea of charging more for beaches for visitors who don't pay other taxes, as he mentioned, and charging perhaps in different, just different tourist taxes, if you will. He's comfortable with having fewer tourists if it does mean that there's less impact on his island, and one way to deal with that is to charge more. So we'll see where that goes, but I know a lot of people will be watching that. Maui is so very popular.
Yeah, and the striking thing is, although he is on a different island, a lot of what he is experiencing and the topics that we discussed are some of the same things that we've heard from other mayors from other islands, as well as, of course, our mayor here on Oahu as well. So a lot of similarities, a lot of the same issues each of these leaders on various islands are having to deal with. We're going to be switching gears a little on Friday and bringing on a guest who we have not had the opportunity to speak to yet.
That's right. We'll be talking to Max Otani from the Department of Public Safety. We know that early on in the pandemic, the issue of COVID-19 outbreaks and clusters in the prisons was a big one, continues to be something that needs to be screened carefully. And so we're going to be talking about that, plus other issues with the Department of Public Safety. There's a lot to dive into there. So we're looking forward to that conversation. And we do hope you'll join us at 10:30 on Friday.
Until then, please continue to stay safe, and we'll see you right back here at 10:30 for another edition of Spotlight Hawaii. Aloha.